questions.
Thank you, Mr. Chairman. We've talked about the overdose deaths, the crisis that we have there. And first of all, I think we're talking about 64,000 people possibly that died last year. I think that is understated. Dr. Perrick, in your experience, are you seeing where the death certificate does not show death by overdose, but perhaps natural causes?
I think you're right. I think that's probably an underestimate. Certainly the 42,000 for opioids is likely an underestimate as well. A lot of times the death certificates don't get into the specific cause of drug overdose deaths. Toxicology reports take a long time. So unfortunately, these are likely underestimates, and these numbers will get worse, Congressman.
That's what concerns me. I think Ranking Member Cummings made this point that the CDC has lowered the life expectancy for Americans. It's not just because of drug overdoses, it's also because of suicide. For people 10 to 24 years old, the second leading cause of death is suicide. And to follow up with you, are we seeing suicides that are linked to drug abuse?
We are, and these are overall called these deaths of despair. So you see drugs, alcohol, suicides taking a toll across the country, leading to the reductions in life expectancy, as you suggested. There are a lot of factors here, economic factors as well, that lead to this, but they are all unfortunately interrelated in driving the lowering of life expectancy, as you cited.
Well, it ought to be shocking to people that the suicide issue for 10-year-olds to 24-year-olds is the second leading cause of death. And I'm going to get into some area I probably shouldn't get into right here, but it has to do with the number of children, the percentage of children that are on psychotropic drugs that have adverse effects that might lead them to other issues like opioid abuse. And I mean, in my own district, it's no longer shocking to hear that a young high school student has committed suicide. We had 1 week period where a high school that's 4 miles from my house had 2 in 1 week, and another one just a few miles from there. And I think when we're looking at this crisis, we've got to look at the totality. It's just not the people who are dying from overdose. It's also the suicide aspect, and link it all together. I think if we did, we would all just be in shock at the total number. I mean, we've got veterans, 22 a day, committing suicide. I wonder if either any of you have any information about that. How many of those are related to adverse reactions to drugs that cause them to have these suicidal tendencies? Do you know anything about that?
I think they're all, I'll start, I think they can all be related, they're interrelated. I think, Congressman, what you're getting at is the overall importance of looking at the determinants of health and taking a prevention approach. And I think the Drug-Free Communities, for example, program is trying exactly to do that with community coalitions. But that's what we need to do. Prevention, 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 look at the underlying causes, the determinants of health. That's the best way to reduce all these deaths of despair, whether it's drugs, alcohol, or suicide.
Well, there's profiling can be done through looking at DNA before anyone's prescribed a drug that would lay down some markers about the effectiveness of the drugs and the propensity to lead them to other things. I think that might be part of the solution. Mr. Carr, we're talking about fentanyl, and one of the things that I've talked about with some of the folks in law enforcement is they're now deploying dogs that can sniff this out, particularly what's coming in the mail. A lot of this is coming from China. A lot of it's produced by North Koreans. I made this comment to former Governor Chris Christie that we've gone from a war on drugs to a war with drugs, it seems like, and thousands of Americans are falling victim. One of my concerns is, and I don't know if you can answer this, is that if we're going to try to interdict this through the mail, what are we doing to interdict it through the mail that goes to Mexico and Central America and Canada that comes across our border?
That's a big problem. The U.S. Mike is not
I'm sorry.
Thank you, Mr. Conley.
Congressman, that's a big problem. But one of the biggest facilitators of drug trafficking, by virtue of the fact that they're such good shippers, is the U.S. Postal Service.
Right.
And I know there are efforts underway that the U.S. Postal Inspection Service has to that are using computers and computer programs to profile packages. We're working with them right now with our OD MAP project, because when we detect spikes in overdoses in geographic areas, then we hope to go work backwards and target the packages that did come and are coming into that particular area, so we can be more effective in the interdiction. But one of the problems with the way that they're shipping now is the fact that they're shotgunning. They're not sending big loads. They're sending multiple smaller loads. So it takes a lot of manpower and time to pick off those loads. And so if we got the old 10%, I'll pick a number out of the air, we got 10% of them, 90% of them are still getting through. It's still a problem. Could I go back to one comment you made, and that's about, and it was touched on, about prevention. We're using the ACEs model. I think that's something, that adverse childhood experiences, to help us profile young children. We're working with the schools in Jefferson County, West Virginia, particularly in the city of Martinsburg, the police, the school, the Board of Education, the counselors in the school, public health officials, all working together to identify those kids most at risk and to do something not only with them but with their parents. And that's the future of this. We have to look at long-term prevention if we're going to be successful in this.
I agree 100%. Mr. Chairman, if I may, I just want to comment on your opening comments. One of the things that indicates how widespread and serious this crisis is, I don't think I know anyone who does not have a personal story of a friend or a colleague or a family member similar to what you delivered. And I thank you for that, and for your indulgence, and I yield back.
Gentleman from Alabama yields back.